So it's my pleasure to introduce Robin to the group. She will be sharing an overview of the navigation role in the post-stroke transitional care programs that are across Northeastern Ontario. She's the stroke community navigator at the Friends, which is an organization in Parry Sound, and is one of 6 navigators in Northeastern Ontario. Prior to this role, she worked as rehab support worker in the post-stroke transitional care program. She's also the Caregiver Support Program Facilitator at the Friends, where she facilitates support groups and provides one-to-one support for those caring for stroke survivors, as well as caregivers of any other diagnosis. Robin has a background of experience in activation in long-term care, as well as dementia care in education. So we're thrilled to have you here today. Welcome, Robin.
Thank you. Okay, yes, so thank you, Sue, for inviting me to join today. The post-stroke transitional care program has been mentioned a few times already throughout the day. And I just wanted to take this opportunity to share a little bit about our program, as well as the role of the stroke community navigator and how we support stroke survivors. So I just have 15 minutes, and I recognize that we're at the end of the day, and the most important thing is to finish on time. So I will make every effort to do that. So what I would like to accomplish in the next 10 or 15 minutes is to identify what the role of the navigator is, to let you know what the different programs are that are offered through the post-stroke transitional care program, and then also let everyone know how to refer any clients to our program. So as Sue mentioned in the introduction, there are 6 sites of the post-stroke transitional care program in the north. I work out of Parry Sound at the Friends, and Marsha Dimes does have 2 sites, one in Timmins and one in Sault Ste. Marie. We also have a site in Sudbury at ICANN. ICANN has been mentioned a few times throughout the day as well. And then Farah in North Bay, as well as in Temiskaming, there is a post-stroke transitional care program as well. So each of these sites have a navigator, as well as rehab support workers who run programs with clients. So within the program, we do have the navigation services and the rehabilitative programs that I mentioned, and we also do offer some education and support groups. So I'm going to explain what each of those are for you. So basically, what is a navigator? So there's a definition here, but I like to think of the role of the navigator as that point person, that support for the stroke survivor and their family. Ideally, we like to connect with the stroke survivor right at bedside in hospital to let them know, I'm your person, I'm here for the long haul, and my job is to help you navigate the system, as well as navigate your stroke recovery. And we do stay with the clients for at least a year, providing check-ins and that type of thing. So the whole navigator idea actually came back in the 1990s. It was originally for cancer patients. And again, it was just that point person, that opportunity for people to have someone to connect with. As you all know, there's a lot of emotional things that go on after a stroke. There's lots of information, and it's a difficult journey. And often, once someone gets home from the hospital, they just don't know where to turn. The one thing I find that often happens is the person is getting so many phone calls from so many different service providers that they can't even keep this straight. So part of what I do in the navigation role when I meet someone in the home for the first time is find out exactly what's available to them and let them know, okay, you have this coming in, you have that coming in, this is available. Oh, no referral was done for this, so why don't we get that in place for you? That type of thing. So as a navigator, we're part of that multidisciplinary team, and we work with therapists and the rehab staff as well. I'll speak to that in a couple minutes. So when we receive a referral, we make contact with a stroke patient within the first 3 days. And then when someone is discharged from the hospital, we get to their home as soon as we possibly can to do that initial intake. Often we've already met the person in hospital as well, but once they get home is when we do the actual formal intake on how they're doing at home. As the navigator, we do meet with the clients at least after 3 months, 6 months, and then 1 year. Or sometimes if the need is identified, we'll meet with them more regularly than that. And we look at target areas for recovery, facilitate connections. Again, like I mentioned before, getting those referrals in, not only for the stroke clients, but also for their family members. And sometimes as a navigator, we do accompany people to appointments or recreational centers, that type of thing, depending on their goals and what their needs are. So as our role of a navigator, we do have outcome measures that we complete with all of our stroke survivors at intake, and then the 3 month, 6 month, and 1 year mark. The integration to normal living index, which was mentioned earlier, is one of the surveys that we do with the individuals. This really helps us in the beginning to get a baseline of how the person is feeling about their stroke recovery. It gives us insight on goals and what it is that's important to them at that time and what they want to work on in their stroke recovery. So the first one that we do just gives us that baseline, and then after 3 months when we redo it, it helps us to kind of see, how the person is doing. They rate many different areas of their life from 0 to 10. So for example, the one listed on the slide here is moving around my living quarters as I feel necessary. How is that when you first get home from the hospital on a scale of 1 to 10? And then 3 months later, how is that going? And there's many different areas that we look at. I was thinking about this when Kai was speaking earlier about the whole recreation and the return to leisure piece. I find that often, at the beginning, people are not thinking about leisure. They're thinking about, getting in the shower. They're thinking about their rehab that they're doing, getting to appointments, all of that type of thing. But then, at the 3 month or the 6 month mark, that's where it kind of comes out that, I'm kind of feeling isolated and I'd like to get out in the community again. So this outcome measure that we do helps us to keep on track with the clients on how they're feeling and what their goals are in those areas. The other one that I think is really important that we do is the hospital anxiety and depression scale. And there was a lot of talk earlier this morning about this. And when Brian and Corey were sharing their story, I was thinking about how important it is that we do this depression screen with clients every 3 months, because as they mentioned, it isn't always brought forward. So our program is not medical, so we do the screen. And then we would follow up as, with discussion with the client. Perhaps sometimes we follow up by sending the scale to their GP. Sometimes we'll do referrals for social work, just depending on what the person wants us to do. But again, we're screening for that every 3 months because sometimes those symptoms kind of sneak in a little bit later. We also screen for fatigue. Using the fatigue severity scale. That one is a great one that, again, sometimes we will send to the doctor as well, but it also gives us some a springboard to kind of talk about that fatigue management, which is often very important with the clients. The other one that we do is asking just a general question about how they would rate their overall health. Whether that's excellent, very good, good, fair, or poor. And that gives us a good picture of how they're feeling overall as a person, which is so important. So these are things that we do with the clients every 3 months. And then based on these, there may be other referrals that come in. There may be other things that we do as far as rehab and goal setting and all that type of thing. So as I said, there are 6 sites of the post-stroke transitional care program. On this slide here, and I understand you all have a copy of the presentation. Do be warned, I did change around the order of the slides. So all the slides are there, they're just in a different order. But it lists here the navigator at each of our sites with their contact information. So if you wanted more information or wanted to get them connected to our program, this is where you would find that information. So that is the one piece of our program, those navigation services. We also have our rehab services. So unique to our program is that all of our classes and individual rehab sessions are prescribed by therapists. So each site has contracted an occupational therapist, a physiotherapist, and a speech language pathologist. And then based on clients' needs and also the assessment that the navigator does, we would have them assessed by the therapist for certain programming. So from the physical perspective, we have a number of physical programs. So one is called physical activities. You can see it on the list here. That would be one-on-one prescribed by a physiotherapist with a rehab support worker doing the exercises that have been prescribed by a physiotherapist. The programs last for 3 months and then they're reassessed. If the person has more abilities for the time program, which is a exercise program specific for stroke that was designed by Toronto Rehab. The person needs to be able to walk 10 meters with a walking aid to qualify for that program. Then it's a small group of 4 clients. Again, the physiotherapist does outcome measures and does talks about goals and all that type of thing with the participants, and they do that program for 3 months at a time. The FAME is a higher level balance program, also designed for individuals with stroke. And the Stronger for Longer is another class that's mostly seated with some sit to stands as well. So just depending, what the levels are of the individual, our physiotherapist will recommend which class they go into. We also have, working under the occupational therapist, we have our GRASP program, which is upper extremity hand program. Sometimes that is one-on-one with the therapist, and sometimes it's into the group setting. Again, a small group of 4, but with individualized programming. The mirror therapy is also recommended by the occupational therapist sometimes. Some of our sites have aqua fitness, not all of them, so you would have to just double check about that. And also under the occupational therapist, there is some cognitive rehabilitation. So when Nicole was talking this morning about the return to work resources, we have used them in our cognitive rehabilitation program. Just one quick little story. We had a lady who was like, I'm going back to work. I'm going back to work. But, with the direction from the OT to kind of go through these surveys, she realized, oh, I'm really not quite ready yet. That this is a goal, but I need to work on this and to get ready for that return to work. And then we helped her with that. We had another individual in our COG program his goal was return to work. He was a professor at a university, and in our sessions, as prescribed by the OT, he would practice facilitating his classes with me. I was the rehab worker at the time, causing all kinds of distractions and noise for him. The other thing that he did as part of his homework for that program was he created slides to use and notes to use, whereas before he always taught off the top of his head, but he wasn't able to do that anymore post-stroke. So those are the kind of things that we work on. Life skills as well. Those daily ADLs, working on coming up with strategies and implementing those as well. We do also work with a speech language pathologist who offers speech rehab individually one-on-one, as well as some communication groups. And then some of our sites also have a coffee talk conversation practice group that is run for 3 months at a time as well, under the supervision of the SLP For those with aphasia, which we've learned a lot about aphasia today, we use those techniques that were demonstrated to allow them the opportunity to practice with other people that have aphasia, just getting comfortable using the strategies. So the last thing we also have is a number of education as well as support opportunities. We have an education group that runs virtually every month. There's a different topic, and all stroke survivors, along with their family members, are welcome to participate in that. Also, at each of our sites, we have an in-person monthly support group that allows people the opportunity for that peer support as well as education and just opportunity to talk about their experiences, which is very beneficial. And lastly, we also have a caregiver support group. So I was thinking of Corey when she spoke at the beginning of the day, how she would have really benefited from the opportunity to get together with other caregivers who are caring for someone who's had a stroke and just having the opportunity to connect and discuss the challenges as well as just have someone validate that, yeah, these feelings are normal. So how to refer? So someone can call us and self-refer. We can receive referrals from the community as well as doctor referrals. There is a form that I can make sure is sent out to everyone. It can be sent by email, fax, or mail, and then the navigator would follow up once that referral has been received. And that is it. If we have any questions.
Thank you, Robin. Fast. Sorry about that. But I thought it was important for people to hear about the navigators and to have one of the navigators speak on behalf of the group. So thank you very much for that. If anyone has a question, please put it in the chat. The referral form, do you think you could stick it in the chat right now? Is it available on a website somewhere?
Let me see if I can get it for you.
Okay, we'll see if we can put that in the chat for people so they can download it and have access to it. You mentioned that the education group is virtual.
Yes.
So that means anybody from across the Northeast can attend that education group.
That's
Is there anything else that runs virtually through the post-stroke transitional care programs?
Yes, and thank you for asking that. Many of the programs that I mentioned, as far as the rehab programs, are offered in person or virtually, just depending on the needs. Some of our areas that we support are very large. So for clients to get here in person can be a barrier. So we do offer, depending on the site, but time is offered at home. Time at home it's called. The Stronger for Longer is offered virtually. Sometimes the upper extremity one-on-one program can be offered virtually. The grasp definitely is. And also the caregiver support group. So the caregiver support group is open to caregivers across the 6 sites as well, and it's offered once a month.
Okay, that's great. So people can check in with their local Navigator and post-stroke transitional care program to see exactly what's offered there. Steve did mention that the referral form is on the ICANN website and can be accessed through CareDove. And Amanda and Kayla both posted some referral forms, so people can download them right now and then they'd have them on their computer. Really great. So
And
thanks.
I'll try to figure out how to do that in PostStarts.
Well, are they all the same?
They are basically the same, but the contact, the fax numbers and that kind of thing is different. So if you end up sending it to the wrong site, we'll make sure that the right person gets it.
Okay, perfect. Thank you. Okay, so thank you very much. I appreciate you taking the time and filling in to do this talk with us today. And I look forward to people referring their clients immediately to the post-stroke transitional care programs across the Northeast. Thank you, Robin.
Thank you.